So there's a lot of different offending behaviors. So Danny, if you ask about in general, sex offenders in general, there's usually two factors that are found, not always, but usually two factors are found: problems in forming meaningful relationships with others, and antisocial personality orientations, no lack of capacity for empathy or remorse for their behavior, or connections, ability to connect with other people. So those are deficits that you see: relationship deficits, empathy deficits. So that's the two biggest factors. If you want to add in those that look at child pornography or who touch children, sexually abuse children, there's a high preponderance, of course, pedophilic behavior there. And oftentimes we also see mental health issues. Person's confused, chaotic, doesn't realize the seriousness of their actions or behaviors, or they engage in behavior with someone who's an adolescent. So you have an adult who's engaging in behavior with a 15 or 16-year-old who misreads all of the cues, who misreads this person's approach and behavior to them, feels like this is their true love and it's just a matter of age, and they connect with that person and feel like love can overcome all of that. So people tell themselves misrepresentations and cognitive distortions to justify the relationship with 15 or 16-year-olds sometimes. So again, there's a myriad of excuses and reasons and rationalizations that people make for their behavior.
Right. And just kind of to kind of bring our conversation around, when you're evaluating these different kinds of people, and I had a therapist, I had a spiritual therapist. We were talking about, human nature, good energy, bad energy, that kind of a thing. In your evaluations and your history of seeing people come in front of you and kind of following along with them, going through cases with them, what is the number one factor that when you see a person that's actually rehabilitated or gotten to a point where they are able to, progress in society and do better, what are some of the factors that you see that would lead you to say this person has the ability to rehabilitate or is rehabilitated, in whether it be violent offenses or sex offenses?
There's a couple of factors, Danny. I mean, the biggest one is kind of the ability to empathize with other people and to see the harm that you can cause to other people by your actions. And there's empathy deficits in individuals oftentimes that engage in any type of sex offense. So whether it's sexually offending, putting, drugs in in a young lady's drink at a bar, and then when she passes out, taking her home and sexually assaulting her, or sexually assaulting a child in an amusement park. Those people usually have empathy deficits that therapy and treatment, which is long-term with sex offenders. Sex offender treatment usually lasts years. And over those course of years, they're trying to retrain or maybe train for the first time the person's ability to empathize